and 1.
Okay, well, thanks everyone for coming. It's nice to have more of a family style atmosphere during this open forum. So my name is Elise Yarnell, and I'm the Director of Access for Providence Medical Group. My friend.
I'm Steve Phillips, Superintendent here at Newberg.
We're really excited to be able to have all of you out today to give you a mini presentation of how we got here, why are we opening a school-based health center, and then also what services that you can anticipate for your child to receive at the school-based health center. More importantly, probably what services your child probably won't receive at the school-based health center will also be shared. And then we'll spend some time at the end to really take question and answer. And next slide, Phoebe. Are you doing the slide? Oh, Tony Buckner.
Two-factor identifying who I am first.
So a lot has gone on in our community in the last couple of years, and I think I would be remiss as a leader to not acknowledge that and say that a lot of us up on this panel, as in the audience, wear a lot of different hats in a community of this size. And so for the purpose of this conversation, I work in Providence and am wearing my Catholic healthcare hat today. But I'm also a mom, and so I'm super excited that my child will get to go to Newberg Public Schools in 2 years, Edwards Elementary. And so I have that hat on today, really trying to build the future of this school district as a community leader and do my part so that the schools that my kids and my kids' friends go to is somewhere that we continue to be really proud of. And not to Dr. Phillips' horn, but I just also would like to publicly say that Dr. Phillips has been a really a champion of this project, and I really couldn't have asked for more support than he's given us for this school-based health center. And so thank you to Dr. Phillips for that as well. So.
Thank you. And I'll just say a few things. Whenever you come into a new district, or a new building, or I guess a new teaching position, any new job, you inherit things. And as a superintendent at Newberg, I've inherited a lot of things. And some of the things I've inherited haven't been much fun. But the health center has been a lot of fun. And I inherited something that she gives me credit, but I haven't done much. I've just supported it. All these people, they've done a ton of work. And I'm a big fan of the health center. I was in my previous district. I took a health center from nothing to opening the doors. Here I just inherited and was able to do a little bit at the end. And so it's good for kids. And if it's good for kids, I'm a fan. And I have to say that there's been some give and take, right? This health center is not exactly how some people that started the work maybe wanted it. It's somewhat of a compromise, and we'll get into that a little bit as we go through the presentation. But the bottom line is it's good for kids. And I think this will help heal some of the divisions in the community. A great example of how we can work together for what's good for kids.
Cool. All right, next slide. So I also have to mention that today is World Mental Health Day. And it makes me a little emotional, actually, to think about that 5.5 years later, we're all sitting up here together on World Mental Health Day. And so the next slide that really talks about how we got here as a community. It's, I think, no coincidence of the universe, God, your higher power, whatever you believe in, that today we're coming together again today to really formalize what will be the health clinic that was birthed out of some really tragic death by suicides in our community of some young kids. And so for those of you that have been in the Newberg community, Newberg W community, remember that time. And that time, Dr. Ferguson and myself got a text from our now dear friend, Tony Buckner. We were working at Providence Newberg at the time and asking us to come over do a flight team for the tragedies that had happened in the months prior. And so Dr. Tergesen and I were kind of like, okay, why not? Let's go over and see how we can help. And so that was the first really point of contact that happened in May of 2017. And from there, and I hate to put you on the spot, but Lonnie Parrish is here as well, and she and her family through the Austin Family Foundation was extremely instrumental in pulling together what was a consortium at the time of different mental health providers within the community to really ask the question, call the question, what are you doing to prevent this? How are we going to move forward so that we don't lose another kid? And that was a moment in my career that I will always remember because a lot of us on this panel were actually at that meeting, and we all were like saying, okay, this is what we do in our organization, this is what we do, and I had this moment of like, wow, but I don't know you, and you're doing a lot of the same services that I'm doing, but we're not coordinating. And so that was really the birth of what I would call a collaborative relationship between the organizations. And I'm a type of person that I like to address things head on, and so I know that there's some people in the room that have questions around Community Wellness Collective, so I might as well just talk about it. So Community Wellness Collective was actually born out of that conversation between the organizations to stop reinventing the wheel and duplicating services and taking the small portion of money that we have within this community around mental health and say, how can we work together instead of competing for services that we could decide a year in advance. Providence is going to own this area of focus, Lutheran's going to own this area of focus, HHS will own this area of focus, and that's really what Community Wellness Collective was. From there, and I'm going to let Tony speak in just a second, but from there we opened the Wellness Center that was in operation for a few years. And again, Community Wellness Collective was never a service provider. And so I know in healthcare language it's confusing. What does that really mean? Community Wellness Collective gathered the organizations and fundraised for the space. So we were the stewards of the financial investment, but we never operated services. The organizations up here on the panel were the service providers. So now you can see in May 2020, the school district passed a bond, which really was that formalizing of, yes, we in fact do want to have a school-based health center that is a formal investment into not only mental health, but physical health. In full disclosure, Providence doesn't do school-based health centers. So that was that initial conversation with the administrative team at the time. Providence, myself, within Providence, we really said, that's not something we would be interested in doing. They did discernment within different organizations within the county of organizations that are more typically suited to do a federally qualified health center. So Virginia Garcia would be an example. And there really was no other organization that was able at the time to step in as the medical sponsor of the school-based health center. So that is when then Providence went back to the drawing board and said, okay, if we were to do this, how could we do it on our terms? And so many people know Providence is a Catholic healthcare organization, so a rather conservative organization. And so how could we do this? Is it in alignment with Newberg Public Schools and what their hopes and dreams for their school-based health center is? Come to find out, we were able to come to an agreement and actually very aligned visions of what we would see for adolescent physical and mental health. And then Providence decided to enter into a formal MOU with the school district to act as the medical sponsor. And then in June of 2021, the school board voted to approve the funding allocation from the bond for the school-based health center. So that June 2021 to where we are today has been a lot of work from a lot of people up on this panel and a lot of people in the room to go through a full Oregon Health Authority credentialing process, which we'll get into in a little bit here. The really great thing about the process through OHA is that the medical sponsor and the school district is able to really form how they want their health center to look. So there are parameters or guidelines, guardrails that we have to meet. There's the bare minimum, but then anything above that, we can really design together. And that's where Dr. Phillips was mentioning, you know, my vision of the school-based health center versus his version of the school-based health center. We've really been able to meet halfway in a lot of different areas. And for me, the most important thing is just that we get the health center open. The compromises that we make along the way so that the community all feels comfortable with the health center is the most important. Not whether Providence is going to get everything they want from the center or the school district is going to get everything they want from the center. I want to build this so that in 10 years it's still here. And it's something that we're all really proud of. So now I'd love to hear from Tony, and just from a school district perspective, what it's been like to work with the partners, and then also maybe speaking a little bit about the time of 2017 and how that's impacted your career.
I'll put on a filter for what it's been like working with these providers. No, it's been great. It's been really fantastic. We had a lot of dark years and dark times in 2017 and even around that year earlier on. Losing a student is never easy. It wreaks havoc on our school climate. It wreaks havoc on our families, and our kids are never the same. And so we wanted school to be a safe place. So I remember this meeting that we had with a superintendent prior to Dr. Stevens, Dr. Kim, and one of the things that we did, we had some hard conversations with our community and said, we have to do more as a community. Otherwise, we're going to be in this space every single year. And who's willing to step up? We had firefighters, we had police officers, we had Department of Human Services, we had Providence, we had everyone that basically resides or lives or works or commutes through. We had a group of, I want to say, about 80 different people from probably 50 different organizations. And the providers that you see out here today are the same providers that pretty much have been along with us throughout that journey. So from 2017, very sluggish. We didn't know what we were getting into. It was just, how can we provide support for kids? Either through our flight teams, either through just mental health support. When we have a kid in crisis, our counselors are fantastic at the high school, but they're nowhere trained to start phasing kids through the ED and knowing who to send, who not to send. We didn't even have a standardized assessment for kids that were suicidal. So that's 2017, and up until that point, we've been making a lot of stumbles along the way. But luckily, none of our providers left us. None of them, they stuck with us. The school district can be challenging at times. And they stuck with us, and they really provided a huge support for our kids. I can say right now, if you were to ask any counselor at the high school over at Catalyst, kid says they want to hurt themselves, they're really depressed, they don't feel safe at home, every single one of them will have the exact same response. And that's really in gratitude to these providers for helping us along the way and knowing what to do. So, can I just give you a big shout out for So besides the mental health part, but it's also kids that didn't have supplies for school, kids that were using drugs and we didn't have any other way to support them other than just expelling them. There's other ways out there and we didn't have the tools to do it. So again, through all these providers, through our local police department, through Moreland and Kosmicki and others out there, they helped us develop ways to keep kids in school, minimize the impact of mental health, and continue to help the kids know that they have a trusted adult in the school system. So from 2017 to where we are right now with operating the school-based health center, I couldn't tell you I'm more thrilled right now. Because not only are we providing services within our school system, so it's a 5-second jaunt to go from the front doors of the school to a behavioral health clinic. We don't have to transport, we don't have to drive kids anywhere, we don't have to call parents up and say, can you come pick your kid up because they need to go somewhere? It's all right here. The kids will have easier access to their mental health supports or physical health supports or chemical dependency supports. All this is right here at our fingertips. And I'd have to say, within our community, this school-based health center is the nicest. I don't want to brag, but sorry, Tiger, you got nothing on us. Sorry, Sherwood, sorry, Mac. This is a beautiful building, and I couldn't say enough about Austin's, about Providence, about HHS and Yamhill County, and everybody that's really pulled together, and our school board. and our school district. For finding the space, we went back and forth for, gosh, what seemed like 9 months, trying to just figure out what space made the most sense. And having a building on our campus by far made the most sense. At least I forgot the second part of the question. What do you want me to talk about? Okay, I'm going to give the mic back.
Actually, more.
Oh, there you go. Great.
Who are you?
I'm Officer Moreland. I'm with the Newberg Police Department. I'm the school resource officer here. I have been so for 11 years. I've been a first responder for 31 years. Firefighter EMT for the first 8 of my career, and police officer for the last 23. Broken kids are heartbreaking, and suicides are the worst thing to do with. There's few things in my career that I've seen that makes a better impact than what this program has done. I can't talk much about this right now. It's been great.
Great, now we're all gonna cry. Okay, let's move along. All right. So, this is really just a one-pager for parents. So, in your packet, prepared by our good friend Tony Buckner, you have a list of resources that if you get to the end of this conversation and you're like, I really need to talk to Moreland a little bit more about what he said, or I really want to talk to Elise about, the opt-in program, or whatever it is, our contact information is on there. We want to hear from you, even if it's something that you feel like is something we don't want to hear. Those are actually the most important type of questions and feedback to get. This conversation today is not to get a rubber stamp of approval. This conversation today is to learn from what you want for your kids in our community so that we can evolve the school-based health center to be a center that we're all proud of. So we really do want to hear those questions, comments, and concerns. Next slide. Okay. So what is a school-based health center model of care? So a lot of people have asked, is this a primary care clinic, meaning a family medicine pediatric clinic? Is this an urgent care? What is this that we're talking about today? And the best way I can explain it is very similar to a family medicine practice that has the ability to do a little more enhanced urgent care type service, so urgent care light services. But we really are focusing on those chronic diseases of depression, anxiety, diabetes, hypertension, asthma, those conditions that oftentimes our adolescents and families with a busy schedule, working parents don't have the time to get their kids into a clinic that doesn't answer the phone, right? So this is supposed to be another access point for routine care needs to really help be a more ease of access for your family. It's an Oregon Health Authority model, and we have our Director of Public Health here with us today, Lindsay Manfred, and she has been an incredible partner since I came to Newberg, and she will talk a little bit more around consent and state statute and any questions we have around specifically school-based health centers around the state. She has a lot of really great information. And then, like I spoke of, I just want to give credit where credit is due. Melissa Taylor in the room. She's a nurse from Providence, and she has, she's the organized one of our group. And so she has been keeping us on track with all of our Oregon Health Authority credentialing that we need to go through. It's a lot. We don't do this in Providence with our medical clinics, and it's a lot of work to get everything done. So we have 10 policies that will be made available to all parents. Tony will show us at the end of tonight how you can access that information off of the school website, and then there will be a landing page also on the Providence Medical Group site, so that you can take a list of our policies, and if your child is seen and you feel like a policy wasn't followed, we want to hear about it. We're learning too, and we want this to be the best experience possible. And so then medical sponsorship, what does that really mean? So within the room or within the clinic space, we have Yamhill County. So raise your hand if you're the Yamhill County. Lindsay and Tiffany, where are you? And Sylvia. And Robert. Woo! So we have Yamhill County Mental Health, and then we have Providence. Raise your hand if you're at Providence. And then we have our school district team. And then we have the resource room. Oh, Jan. So Providence is the medical sponsor, which really means that we are the lead organization around coordination, collaboration between who's coming in and out of the building. We're really like the tenant of the Newberg Public Schools owned building, is the way I think about it. And then Yamhill County is kind of like our subleasers. So that is how that works. And then, just that this is our commitment to being an additional access point in an already rural community that struggles with routine access to healthcare. School-based health centers are a touch point throughout the state in a lot of really rural communities, and we'll share some of the other school-based health centers in the state that you may be surprised that they have a school-based health center, and so that was pretty interesting to see as well. And then we get to the compromise, the opt-in model. So when we started this conversation, let's go to the next slide. There are three options when you open a school-based health center. There's full access, meaning that anyone that walks in the door is seen within state statute consent laws. That, transparently speaking, is what most school districts are in. There's opt-out, which when we came to the table, Tony and I were hoping for opt-out, but we, after having conversation with both Chair Brown and Dr. Phillips, really did both come to the agreement that opt-in is the right model for this school-based health center as we really build trust in a really politically divisive climate that we're living. And so we hope that over the years to come, we can build that trust so that when you send your child to the school-based health center or your child accesses the school-based health center, we're a trusted figure within your household. So what it really means is that we will have it's a Google form, I think. Is it a Google form? Yeah, let's look at it. So Tony has made in English and in Spanish a form that is on the Newberg Public Schools district site. And so I'll let him navigate over to that. And so this, as a parent, guardian, safe adult, can be filled out on behalf of your student. If you want your kids to be able to access the health center full board, right? So you're cool if your daughter Jerry goes and accesses services. We want this form filled out on your child.
So the form is very complex. So it does go through the scope of services that we have, but then you'll see down here as we go through, you have to put your kid's name, their grade, your name, your phone number, that you're okay with the kids being served at the school-based health center, and that you understand that there are some basic laws around when kids can access the school-based health center on their own. Click I understand, you click submit, that's it. So super easy. If you're wanting to do it in a different language, we do have, if you just click on this, not the right, if you, online, on the district website, I can board up right now. Here's our district website. You click on the school-based health center form, and it should say you want it in Spanish or in English. Right now, here it is in Spanish. It's the same questions, the same information. Student's name, grade, your phone number, and that you understand you want your kid to be seen at the school-based health center, and then that you understand these rules and laws that are linked to that. That's it.
Great. So yep, there we go. So we'll do a little scenario. So if Lonnie, I'm looking at you, comes into the school-based health center, someone at the front desk, registration, I'll be registration, says, hey Lonnie, how are you doing today? Looks like you don't have your opt-in form from your parent. Have you had a conversation with your parent or safe adult for coming in to be seen today? Lonnie says, no. We say, all right, would you like to, can we encourage you to give one of your parents or someone in your family a call to consent for your care today? Lonnie says, okay, great. So historically speaking, I can speak from a medical provider standpoint, typically that encouragement to involve an adult, that's best practice We're going to do that whether it's in a clinic setting, in a hospital, or in a school-based setting. Every time, not just that one first time we see Lonnie. Every time Lonnie comes in, we're going to say, Lonnie, you know, we'd love to include your mom in this conversation.
So if say I wasn't feeling well, and I think I have COVID or something, and I really wanted to be seen, but I don't have my form, would it be possible to call my parents
Yes.
and then do it online so I could maybe be seen that day?
Yes.
Awesome.
Correct. In the case that our encouragement to involve a safe adult, Lonnie says, no, I still don't want my family member to be involved in my care. We say, okay, no problem. Take Lonnie back into an exam room. We triage Lonnie, just like we would in a medical clinic. Understand her environmental situation with her family and if it's possible to involve an adult in that care. Oftentimes, that kid may be experiencing abuse, neglect at home, okay? And so in those scenarios, there's a very, very valid reason that that child is not wanting to involve that parent in care. I know for people that are here in the room really engaged in the conversation, sometimes we do forget about the percentage of kids that are in that scenario. And sadly, we do have a percentage of kids in that scenario. There also is the scenario where Lonnie comes in and says, no, I do not want my mom, Elise, to be involved in my care. And after talking with the provider, there is agreement that Lonnie is 16 years old. Lonnie, by state statute, has the ability to consent for her own care. Those are the situations. I think it's really important that we be transparent, that there are no surprises that you end up hearing about. You can hear it from my mouth. That 2%, right? It's a small percentage that that's going to happen. But Lonnie coming in because she doesn't want her parent, we will adhere to state statute. And this is something that I really want people in this room to hear from me, that we took through Oregon Health Authority and the Department of Justice, because there are other districts that do follow opt-in, meaning if the opt-in form isn't filled out, Lonnie is unable to be seen. There are other districts in the state that have followed that practice. The Department of Justice and Oregon Health Authority did not feel comfortable saying that that would uphold in court, right? So that would not be kosher with current Oregon state statute. So it's important for us to remember what minor rights there are, and then where parental rights there are as well. So my commitment as Providence lead sponsor of the group is that in every encounter, we are going to encourage parental involvement. At the point of registration, at the point of rooming the patient, at the point of treatment, we are always asking, how can we involve a safe adult in this conversation? That would be the same as if they went to they could walk into the Providence Emergency Department. But there would not be that first step of an opt-in form at any other place that really indicates to the provider, this person hasn't had a conversation with their parent. We need to go the extra mile and really try to encourage that involvement.
Can I just ask a question on this?
Yes.
So what I'm hearing you say is that the school-based health center is wanting to involve parents at a deeper level than even at your local clinic, whether it be Providence Hospital or anywhere else. Or not.
Definitely. Yes.
Hi everyone, I'm Lindsay Manfred and I'm the Health and Human Services Director and Public Health Administrator for Yamhill County. I'm really happy to be here with you. I thought I would share a little bit about the county's role. We have two roles. One is that the contract with the Oregon Health Authority for the school-based health center here, as well as the two other school-based health centers that are in Yamhill County, come through County Health and Human Services. So that contract comes to me, as well as a small amount of funding. It is not enough funding to sustain an entire clinic, but it is some that helps. And then we, as the county, contract with the medical sponsor. And Elise did a really nice job of describing what the medical sponsor is. And of course, here in Newberg, that medical sponsor is Providence Medical Group. And so that funding comes through us, through the Oregon Health Authority contract, and then we contract with Providence to push those funds through so they can use them for their operations and costs that you incur when you're opening a clinic. And then, in addition to that, there's
Let me say how much it is.
it is $60,000.
For the record, we're not making that up.
No one's making money here. And in fact, I can say, we have two other school-based health centers. One has been open for over 15 years. I want to say at least 20 years. And then we have another one that's almost 5 years old. And we have different medical sponsors for each of those and different contracts. And then different MOUs between the medical sponsor, HHS, Health and Human Services, and the school. And I can say that there are more similarities in all of those than there are differences. But like we said, right, there's the core standards that the school-based health center is required to follow based on Oregon Health Authority's requirements. And then there are some differences and uniqueness in each of those as well. And I will say one of the things that I do love is our Willamina School-based Health Center that has been around for over 15 years. I've been with the county for 15 years, and it's been there the whole time I've been there. I was a nurse leaving, vaccines and things in there a long time ago. So I know it's at least 15 years old, probably, but I know it's actually older. It's been in the community for so long, and it's so deeply rooted into the community that there is just a general sense of trust, of everyone working together and caring for kids and caring for the community, right? I mean, that is an area that there is a deep access issue from every healthcare standpoint, whether we're talking about physical or mental health. And so it really is part of that way that we often think of schools as being those anchors and things to the community. And so I really do think that over time, we will see that happen in this community too, right? It's new, and everything new always takes a little bit of time to get used to. People have lots of questions, which is wonderful and good. And there's also a lot of expertise, I think, up here of people that have done this before and that are really, really wanting to make sure that they are completely transparent with the community. And I will say that is one of the things that I really appreciated working with Elise and others in the Providence healthcare system is their really desire to go through a very thorough process to make sure that they are doing what it is that the community wants. And I can say the same thing for Newberg School. There was probably the most in-depth planning process that I've been part of as a school-based health center. And we've got two in the community, but we've actually been through 4 different planning processes, and sometimes they just don't work out for various reasons. And I can say 100% this is the most thorough. And I could tell that there was a really deep and genuine desire to make sure that what was put in place is what the community wants and what the community needs. And I think that that's really important, and that was really exciting to me as we were looking at who the medical sponsor would be, to be able to put those things together and think of how well they've been working together.
So this is that minors' rights form that I was talking about. It's on this PowerPoint. I will also make sure we can upload this PowerPoint to this website too. That's totally fine. But this is just a little bit more in-depth information from Oregon Health Authority. It doesn't include the opt-in, so the opt-in will be a part of it, but this is just more information for you. Next slide. So now we're going to talk a little bit about what is offered and what is not offered. So we will first start with what is not offered. I will start with what's not offered. And then we'll transition to what is offered. Because I think also when we think about concern that a lot of parents have around kids accessing healthcare services, if you know what services they can offer, it may also relieve some anxiety. So not offered, and when we say not offered, it doesn't mean that it's a hard stop, do not enter. It actually means that we're going to support the kid and say, how can we talk through this? How can we help you through getting you to the place where you could talk to someone about that part of care? So reproductive health, we're a Catholic healthcare organization. We will not be doing reproductive health on site. Hearing screening. So our hearing screening is done currently through the school district. So we won't need to duplicate services there. Medical specialties means that if your child needs a dermatology referral, neurology referral, we don't have specialty providers on site. It's general practice within the school-based health center. Prenatal care, so if a youth presented and tested positive for pregnancy, we would not be able to care for that youth within the center for their pregnancy. We could, of course, see them for a sore throat, headache, but we couldn't do the actual prenatal care on site, but we would happily help them find prenatal care. Complex psychiatric care, this is a really tricky one because we don't have a lot of psychiatry access within the community. And so our providers will bridge a patient to a psychiatrist, but we're not going to do ongoing psychiatric care for a patient. Hormone therapy, so gender-affirming hormone therapy. If a child presents with gender dysphoria, we will actually go into that topic at length here in a little bit, but we will not be doing hormone therapy on site within this clinic. Threat assessment, it's all you, Officer Moran. We won't be doing threat assessments. And then dispensing of medication. So we are happy to prescribe to a pharmacy, but we will not be dispensing any of those meds for the child to take home. So that really, again, is an additional point of parental involvement to need to go get that prescription. So now I will hand it over. Who's going first? Mel? So I'd like to introduce Mel. Mel Rafalovich is the medical director of the School-Based Health Center. She's my partner, a lot smarter than me. So she actually is from Forest Grove, not from Yamhill County, so this is kind of dumping her in the deep end here. But she is amazing and has a ton of experience, and we'll talk about physical health.
Thank you, Liz. Thank you all for joining us this evening. We're so excited about this project. My background is family medicine and also urgent care. And I love our teenagers. So things that we'll be doing under our physical health component of our clinic is that we will be taking vitals, so vital signs when they come in. We'll get their height, weight, blood pressure, temperature, heart rate, all the normal things you do when you present at a clinic. We will be helping with wellness exams and sports physicals. We've done a few sports physical clinics already here at the school. It was so fun, such a great way to meet some of these kids. And we're just partnering with our sports medicine clinic as well within Providence. So we have a lot of resources. If there's a kid who presents with some kind of concern of a sports injury, concussion, for example, that we may need to call a friend on. So we have other resources in our group that we can help with that. Chronic conditions, as Elise mentioned, diabetes, hypertension, asthma. I know a lot of kids are running around with asthma. We may be able to help initial diagnosis or continuing with the care on that. We definitely want to try and keep these kids playing sports and as active as possible. So we will be able to manage these primary care conditions. The acute care things we'll be managing will be like if they have a head cold, if they have a urinary tract infection, sexually transmitted infections. We'll be able to do some general testing there. We'll have a COVID test on site. And then health concerns impacting academic learning. So if there's a concern there, a student can be seen and we can do an initial assessment. Depression and anxiety, of course, is something that we are always on the lookout for concerning mental health, and so we will be able to do assessments and, again, call a friend if we need to, and I'm looking at Jerry over there. We'll be able to do a lot of vaccinations on site, so just general common vaccinations such as Tdap. I know that that's a pretty big need. Different types of testing, so we'll have a lab, we'll have blood glucose, urinalysis there, we'll have COVID tests, pregnancy tests, and basic lab testing available. Health education and preventative health is really important to me. My first master's degree is in exercise physiology and just really keeping kids active and healthy and just trying to teach them about, maybe cutting out their energy drinks, maybe getting a little bit more sleep. My style is really to weave in some of these just basic general health guidelines when I see these kids and try to get that rapport with them and meet them where they're at if they're receptive. But some of them are. It's just kind of I like to take some of these kids under my wing. And then the last one, certainly not least, is falls or concussions, sprains, and then just some simple wound care. But again, we are definitely interested in different sports injuries or just any type of injury that comes in. We'd like to do an assessment, and we can make recommendations from there.
Great.
I'll pass this to Dr. Teresa.
I'm going to stand up so I can see.
Don't go into the
Okay. So I'm Dr. Jerry Ferguson. I'm a psychologist by training, and it's been an honor to be part of this project since 2017 as well. So I am also a mom in the district, but definitely have my Providence hat on tonight. So our goal, I feel like mental health is a really large continuum. There's a lot of different presentations that come up. My goal is that we can do early intervention and help support kids really in that mild to moderate zone, well before we get to that high-risk zone where we're worried about things like suicide. So the goal for the services that we're providing within the school-based health center are really structured around that mild to moderate mental health presentation, treating things like depression, anxiety, stress responses. I think many of us can remember how stressful high school is, and so making sure that we can do some good stress management strategies with kids, looking at different mood disorders and helping to develop coping strategies. Eating disorders, I think particularly with the pandemic, we've seen a significant increase in eating disorders for a lot of kids, and so making sure that we're doing some early intervention around disordered eating, and then connecting to a higher level of care and resources and engaging families to really help look at some of those patterns that have become more and more common. We started this project around suicide and risk assessment, and so that definitely continues to be a core area where we partner with the school district with kiddos who are making statements around suicidal ideation or have made more direct threats around harming themselves. Those are common referrals that come out to then get an evidence-based risk assessment. We engage families in doing some intensive planning around ensuring safety for kids. We do some diagnostic verifications. We've had a number where partnering with the families are like, gosh, I'm really worried that my kid might have ADHD. And so that's a really great referral that we're able to help kind of tease out, does this kid have ADHD? And then partner with our school counseling staff if maybe an IEP or a 504 is appropriate based on a mental health concern. I also, like Mel, love early intervention. Our high schoolers are not so great at sleep and they love to drink their caffeine. So we definitely work at decreasing a little bit of that caffeine and making sure that we're getting some good sleep, trying to reduce screen time when that's appropriate. And then drug and alcohol support. I think none of our adolescents are immune to the presence of substances and alcohol within the community. And so I know Yamhill County does some really amazing work in this area. So partnering around substance use, harm reduction, and making sure that we can kind of help curb off some substance use wherever possible. And then tobacco cessation is another, I think, both with nicotine use, but then also vaping is becoming more and more common. So how can we do some good intervention for kids in these areas? And then bridging to higher levels of care. We do have some kiddos that have come in and have had really complex mental health needs, that have had active psychosis or really high-risk concerns. And again, I think this is a great space where we can catch those kids, they can land, we can really identify things early, and then bridge to partners in the community like ISA or Yamhill County Mental Health, more direct program, or other community mental health providers who can really offer that complex and intensive wrap support for those kiddos who really need a higher level of care.
How do you connect with the counseling department or Annie, school name?
So it has been an honor to learn the school system and really learn how to partner. So we do monthly consultation meetings that have been a really awesome way to connect and consult about kids. We have a memorandum of understanding, and then we have our kids sign releases of information and have families sign that so that we can do that active sharing across our organizations to be able to say, who's on your radar, who's high risk, these are the kids that we're concerned about from a mental health standpoint. How can we come up with a plan to make sure that they are as safe as possible within the school system? Annie has her eyes on a number of kids, both with, I think, chronic health conditions that she helps to support in her role as a school nurse, but then also from a mental health lens as well. So again, that's a great partnership that she is actively referring kids, highlighting needs. We're partnering around how can we optimize support for their IBS or support for the headaches that they're having, and making sure that they have space to do or get the support that they need. That's going to be really helpful. And then our counselors also do amazing mental health work. So things like initial risk assessments, mental health conversations, relationship distress. They just also have so much on their plates that I think it's a really nice back and forth partnership that they can say, this kid only needs more than what I can give, and they can hand that off to us, versus we can also say, this kid's not really stable, and I think if we can just optimize their 504, they'll be in a great space. So it's a really lovely partnership where we're able to pass back and forth and make sure that every kiddo is getting the right level of care in the right space. And that may not be us, it may be partnering with the families to have them connect somewhere else, but we're able to do some of that easy assessment in a place where they're here 8 hours a day, so it's an easy hop down the hallway to get at least a start.
Perfect. Okay, next slide. All right, so these are the sensitive scenarios I was talking about. So some of this we do, some of this we do light. And so Dr. Ferguson and Mel are going to talk through probably what are your top of mind sensitive scenarios. So we're going to talk about pregnancy, birth control, depression, anxiety, suicidal ideation, and transgender care. So we're going to talk about all 5 of them so that hopefully when we get to the question and answer, you'll have some more information of what would it look like if a child presents with one of those top 5 sensitive scenarios, and how will we handle it, and what is our commitment to you.
So probably one of the most common presentations that we get within the school-based health center are depression and anxiety. And it might be depression and anxiety that was triggered by something, or it may be kind of an ongoing experience that an adolescent has. So our standard clinical response and how we're going to approach supporting these kids is that we're going to do an assessment of their mood-related symptoms. What type of symptoms are they having? How are those symptoms impacting their functioning? Are they really brief in nature, or is this something that has been a bit more chronic and prolonged over time? We're going to assess for a current or a history of suicidal ideation. We know that kids with mood disorders are more at risk for having suicidal ideation, and so making sure that we're being really proactive and just directly asking every kid who comes in to help make sure that we can identify risk early on as well. We're going to talk about risk and safety concerns. So in addition to suicide, are there physical safety concerns within their living environment, emotional safety concerns, neglect? Are there any kind of context pieces that might impact a child's perceived safety around engaging a safe adult? And then we're going to do evidence-based interventions for mood management. The vast majority of our therapists are using cognitive behavioral therapy, which is an evidence-based intervention to help look at kind of what am I telling myself, what are the things that I'm doing that are helpful for my mood, and how can I increase coping strategies into my daily routine? And then we always really strongly encourage family engagement at every visit with the child where that is possible. We are mindful of some of those risk factors like we talked about earlier, so we have had kids come in where there has been active abuse at home that has required a CPS report, or that from an emotional neglect or safety concern we've not been able to engage families, but the vast majority we're really working hard to actively engage the family in their care. For kids who are presenting with severe mental health symptoms or really high-risk mental health needs, and maybe they would benefit from a more intensive program or RAP services, we're working to coordinate that care and bridging them to the appropriate level of support and resource. And then some kids, maybe if those symptoms have been coming around more frequently or more prolonged in nature, they would benefit from a medical evaluation and perhaps an antidepressant for their primary care. So we're going to partner with the family, partner if you have a primary care provider in the community, that's amazing. We're going to connect you in there if that feels like the best option for your family. Or you can see Mel or one of our other amazing providers on site at the School-Based Health Center, and Christy. Yes. Absolutely. So just some additional considerations that I like to highlight is that we're not dispensing medication on site. So if a medication evaluation is something that you think would be happy for your teen, or a teen requests to self-initiate, we don't prescribe medication on site and are really going to encourage family engagement as part of that process. And then Elise touched on this a little bit as well. Receiving services at the school-based health center does not negatively impact the relationship with an established primary care providers. We're really passionate about maintaining those long-standing relationships with the providers that know you well. This is just an additional access point to make things easy for those families who would benefit, or this feels like an appropriate space to access care. And then, consistent with Oregon state statutes, is how we'll be providing care.
Do we want to take any Q&A?
Yeah, let's do
any questions?
Sure. Like it. Question and answers on depression, anxiety.
I have a question.
Yes.
What's the percentage that you have of high school, then middle school, CV versus Mountain View, and then all the elementary schools? If this is going to be access K through 12, as well as our teachers, I think that's
Good question, yeah.
So what are the statistics that you have so far?
Yeah, that is a really great question. Right now, I would say 95% of our patients are high school patients. Because the middle school is not on site, transport is a little bit harder to get them there. If we have a school counselor that identifies a middle schooler that would need services, we absolutely, because of their age, require consent from the parents in order for them to be transported. I know, Robert, I'm looking at you, you see a handful of them. We love to see those kids. So when we can coordinate to get them transported over for services, we absolutely do. Not present tonight is Lutheran Community Services, and they really support our elementary and our middle schoolers with services.
Not in the health center.
But not as a component of the health center. They're embedded in other schools doing other early childhood-based work.
The other thing is that this, I forgot to mention, we're open the building hours are 8 to 5, and we did till 5 o'clock for those families, like a middle school kid or an elementary school kid that the parent wants to bring their child. So we are open for walk-ins until 5 p.m.
That's a great question. Thank you.
So the first slide said that you don't prescribe prescription drugs treatment on site, correct?
Correct.
We're not dispensing medication on site.
That's right. You work with someone who will be off-site, you bring medics to someone off-site, that's what it's going to be.
Dispense.
I'm just trying to clarify.
Yeah, the difference is dispensing and prescribing. So dispensing meaning we don't have a pharmacy on site at the school-based health center. So if I was prescribing Carrie a medication for something, you would need to go take that prescription, whether it was electronic consent or hard copy, to your pharmacy to fill that prescription.
But they are getting prescriptions.
Absolutely. Yeah.
Would that also apply to hormone therapy?
No, we're not prescribing hormone therapy from this site. That's considered a specialty healthcare. And I'll get to transgender health at the end. Yeah. Thank you. That's a great question.
Okay. Anyone else from
Any
depression?
other questions?
I have a follow-up to that.
Yeah.
You said 95% are high school students, correct? Well,
Currently.
what's the percentage of that you are seeing, and the percentage that you think you will see compared to what we do have? Because I know I teach middle school, I know every kid, and I know kind of what some things that are going on.
Yeah.
But I'm looking, it would be nice to be preventive versus like
Absolutely.
take care of when they're a senior in high school.
Totally.
When they're 12. So I'd like to see percentages and what's going to be the increase you believe is going to happen at the health center.
I would have to go back and run some data on the past kids that we've seen, but I could absolutely go back and pull that data based on the kiddos that we have seen up to this point in their age ranges. And I agree. I think from a preventative health standpoint, I would love to get them in younger and younger. Because we know that, like, statistically speaking, mental health onset is around age 12 for a lot of our kids. So the earlier we can intervene, the better.
The other thing to your question that is well taken is I think that it's going to be important that the health center provide data to the school board. And so that would probably be something we could get on the school board agenda on some sort of cadence to share data with you around some of those questions.
I have a Facebook question. All right, thanks, Jen Winks. Question is, if it is determined that the medication is best is the best treatment for a student with anxiety or depression. I understand you don't dispense medication, but you send in the prescription. If a student doesn't want parents involved, how can you help the student in making sure the meds are being taken correctly, being filled, and so on? My concern is if these medications aren't taken correctly, it makes things much worse for them.
Great question. Mel Rafalovich.
Yes, that's a very, very good question, and that's a very important thing in counseling these children, that these medications are, there is a protocol to follow with these medications, and these kids need to be seen for multiple follow-ups. So we would, encourage them to, again, to have a conversation with their parents and then have follow-up with their primary care provider. If they weren't with Providence, then we would try and make some connections to their primary care provider, just from provider to provider for these follow-ups. But I agree, it's very important, and that's the responsibility of this center. That's why we're taking it very seriously to have good education with these kids and involve the families as much as we can, and to get the primary care providers involved. We see our services as bridging care. So we for sure will not be maintaining this, until, so our goal is to get them into their primary care provider.
We will act on behalf. We're happy to see them if they don't have a parent.
We will follow them for as long as needed. But our goal is not to do primary care only for these children, be their primary care provider. Our goal is to bridge them into care, whether it be with Providence or their established provider in the community. Good question.
Thank you.
I have a question. How are the kids going to pay for the medications if the parents are not involved, and if they are coming from a disadvantaged family group? What is the information to provide this prescription and then they dispose of them? Or is there actually an exemption for that?
It's a great question. So we do have some slides on billing, but I'll touch on, so if they're on Oregon Health Plan, it will be a covered service, or their prescription will most likely be covered. But we do absolutely have a student need fund. So if a family, if we prescribe that prescription and a parent says, we really would love to start our kid on this antidepressant, but we don't have the funds to do that, we're happy to support the kid through our fund.
And I have noticed that with Providence or Young County, if students come in, they have zero health insurance, but they're likely eligible for Oregon Health Plan. Alexa, others, I know Robert, Sylvia, they will all jump in and work with the family on providing the documents needed for Oregon Health Plan, get them set up so those medications.
So if the student doesn't want the parents to know that they're taking the medication, then are you guys going to do overtime on that and just pay for the medication without the parents' knowledge?
I think that's where first off, let's talk percentages. So we've got an underprivileged or an underserved represented student who comes in and says he wants to have, or she wants to have medication for depression, but also qualifies under this exception to say, I can't tell my parents that I'm suffering from depression. The provider is saying, yes, it's probably not a good idea, even though we would want people around you in your life to make sure that they know, one, to take all sharps away, or to take away firearms, or to put the protections in place. So that's a pretty small, box, but then, but then those that are there, then I think the fund would apply to that. But again, putting it in perspective, I don't see how we would provide free medications for a student who presents as someone who's either suicidal or maybe a danger to take these medications without having a family at least aware, or some trusted adult to say, here's what the medications are. Now, as a school, we do have a lockup for some students that have ADHD medications, or the parents sign off on forms. And so those have to be signed by a parent in order to have here on our district campus. So again, we would have to work with the families or with the providers to say, how can we keep these medications safe, but at the same time, not have these kids running around selling their Adderall or other kinds of medications. I don't know how we would go and have a kid on ADHD medication without a parent knowing that this is what they're doing. I think it would be a pretty small, one, small number, and two, it would have to be a pretty significant need for that kid to qualify. So, I've never seen it. In the 8 years I've been here, I've never seen a kid qualify for services like that and still have a valid reason for not involving parents. Could it happen? It may. I just never seen it.
So is there going to be a legal team when some child has reactions to something that is prescribed? I mean, have we considered, do we have a legal aspect to this that's reviewing the situation that the school could possibly be under, considering if there is something that happens to a child under this program?
Well, again, these state statutes are in there that says if a kid can qualify under any other program, our school-based health center is even more restrictive in saying we are going to involve parents to a greater extent than even any other program. So, I mean, in terms of like saying, is there something that's going to happen that could put the district in liability or make them liable for a kid overdosing or taking these medications? Like I said, I've never seen a case where a kid got prescriptions that we were worried about them overdosing. Now,
And I'll just say that it's very rare that we prescribe control medications, especially for youth. So I feel like I could pretty much make the statement that it's not going to happen. And Christy's like, yeah, we're just sitting over there. So I can say for concern of overdose or that type of reaction, I think we can give you that commitment. But I do hear what you're saying around a prescription, a non-controlled medication that a child could go and pick up and pay for themselves. You know, if it's $6 for me, from my kid, it'd be $6 for them to go and get a prescription, right? So they could do that. So I think I would encourage, if this seems to be a topic that we want to have further conversation around, we can absolutely do that. I'm open to sitting down and talking through what that workflow would look like, so that we can come to some sort of understanding around that.
I have a question about the liability, since we're on that topic. Who's insured? Is the school or is the center? And if something were to happen, like a malpractice of some sort,
Providence.
Providence.
Yeah. So we would follow our same protocol. If we were at the clinic in Newberg or Sherwood, our malpractice insurance would be liable.
we have a question. Oh, go ahead, Andrew.
No, I was just going back to the beginning where you said that they have to opt in. So everybody that's going to receive care has to have the parental signature unless they're in a case where they're being abused at home or something that's dangerous to them to involve the parents. So there really wouldn't be prescriptive drugs given out without any parental knowledge. And I can understand why everyone's really fearful of that. But this is not, in my mind, this is not any different than that child going to their primary care or to Providence. It just happens to be here at the school, so they have their access and opportunity to get care for things. Is that?
They would most likely have more, the staff would have more parental involvement working with community with parents than they would if they went down to urgent care on Denver Road.
Exactly.
Or any other urgent care. Based on their age, they have the legal right in the state of Oregon to seek the same medical care without parental consent. And as a father, I don't agree with that. I mean, I want to know what my kids are doing.
Yep.
I want to know what medical care, but the law is law, and I understand, I've accepted that I can't change that, I have nothing to do with it. So it's not, they're not going to be getting any more care here at this center than they would in any urgent care.
Exactly, that's what I was trying to say. And the people here probably know those kids a lot better than urgent care. And things. So it's not like the school's bringing in something, they're actually providing a service they can get somewhere else. Other than the mental health is so helpful. So just from my personal experience, I started drinking and using drugs in high school. So it would have been nice to have opportunity for safe places to go talk about that and things. So that was a long time ago. So.
Here, here.
You have a slide on suicidality and
Thanks.
okay. Because I think some of the questions too around escalation of some of these behaviors of moving from sort of depression to anxiety, there is a different response when it is fear of harm to self or others. And so I wanted to sort of going back.
Thank you, Lindsay. So our next is if you have a child who presents with suicidal ideation. So the youth reports to the Providence School-Based Health Center for thoughts or statements of suicidal ideation, or maybe it's brought over by a teacher, a counselor, or someone in the community who has concerns around. So the first thing that we're going to do is do an assessment for risk and safety concerns. So what are those suicidal statements that they are sharing? What do those look like? Do we have physical safety concerns and emotional safety concerns or neglect concerns that are also coupled with that presentation? We'll then do an evidence-based risk assessment where we're going to look at the risk factors that an adolescent has, the protective factors that an adolescent has, and really try to scaffold out what is their risk level from a low, moderate, or high standpoint. Our goal is absolutely, in all cases where there's suicidal ideation, to engage family or a safe adult, unless there is an abuse or neglect concern where we can't do that for the safety of the child. But we really want family and parental engagement for these high-risk kids. For a low to moderate risk child, we're going to do some behavioral health intervention. We're going to do some safety planning. We're going to engage a family and make sure that everybody is on board with a plan that can help to ensure that this child is safe, both while they're at school, but then also when they return home. For high-risk adolescents, where they are reporting plan, intent, we're going to do safety planning that will involve the parent, the guardian, or a safe adult. We want to make sure that there is a team-based approach to supporting these children, that we can do everything possible to reduce their risk, reduce their needs while they're in the community, and come up with a plan that everybody feels really confident in that can help to ensure an adolescent is able to maintain their safety.
And one thing, in 2017, in May of 2017, when Providence came out and did a flight team, with ESD did not have the bandwidth to do at the time, 52 kids in a 6-week period were identified as moderate to severe risk for suicidality. That is why we're here tonight. That is how this started, and that is what we want to avoid in future years. So just to put 52 kids, moderate to severe, it was shocking to our team at Providence. So that puts that in perspective.
And those were the kids we were able to identify during that 6 weeks. We did not assess the entire school during that 6-week period. So that was the kiddos that hit the radar of the people that know them best. We all know that there's a lot of kids that fly under the radar with a lot of high risk. If the youth is unable to effectively engage in safety planning, or the parent, guardian, or safe adult says, I'm not feeling safe with this plan, then we will partner with the Newberg School District, Tualatin Valley Fire and Rescue, our own Officer Moreland, and transfer the youth to the emergency department for further assessment. So the emergency department has a mental health team that is a partnership with George Fox University, and then Yamhill County HHS with their crisis response team, that they come into the emergency department after medical stabilization to do a comprehensive risk assessment and discharge planning. A few pieces that I just like to put out there, that the school-based health center itself does not provide transportation to the emergency department. We are not going to be involved in transporting children. So if those kids need transportation to the emergency department, it will need to be done via non-emergency transport, the Newberg School District's transportation policy, or partnership with Officer Moreland to make sure that we can get those kids there safely.
I would say taking kids to the ED is the last place we want to take them. We go through every avenue we can to get them safe, to commit to safety, to involve other people in making sure we develop a safety plan and feel good about it, and we follow up with that. We know that the ED is never a place where you've got a highly suicidal kid where they want to feel safe. They can't hurt themselves there, but there's a lot of screaming, there's a lot of noise, a lot of beeping. They just want a calm place, and sometimes the ED is not it. And so the last thing we want to do is to take any kid, even, those that say, I want to go there, we still see if there's a way that we can keep them out of the emergency. And that's not only just for financial reasons, but it's also for just de-stressing and getting back to a stable place. Because sometimes the ED is like our last ditch effort to see the kids safe where we know they can't hurt themselves.
We do not have admitting privileges in any of our local inpatient hospitals. So I know that sometimes this can be really frustrating to families, that you go to the emergency department department, you have a risk assessment done, everyone's feeling really anxious, and ultimately the decision is made to return home. We, as part of the clinic, the same is true for like Providence Newberg Clinic or Providence Sherman Clinic, we don't have direct admitting privileges. So we do our risk assessment, we transfer to the ED. It's ultimately the emergency department team in consultation with the crisis assessment teams that makes determinations for inpatient hospitalization or some level of respite care if that's the most appropriate discharge plan. Any questions about risk assessment?
We have been doing this work for 5, 6
This
years.
is the heart of what we have been doing for the past 5 years, is really suicide-driven prevention work with kids.
Next slide.
Yeah, this is.
Okay, so
Why don't you just flow straight into pregnancy and then I'll take a question.
Sure. So for our sensitive topic number 3, birth control, we have a scenario here. A youth presents to Providence requesting birth control. If requested by the patient, we'll provide pregnancy testing in our lab. We'll provide a safe, comforting space and assess for those risk and safety concerns, as we had mentioned before. And it's really important that, as Elise had mentioned, at every touch point when that patient comes into our clinic, we will be strongly encouraging parental involvement in every step of the way. We will discuss and support their healthcare goals. And again, we do not provide any prenatal care at the health clinic. So we will provide a pregnancy test, and then we will refer to ongoing care with specialists. And again, we don't dispense any medications on site, including birth control. So we will just refer to pharmacy. The Providence Health Center will follow all Catholic healthcare tenets and ERDs as applicable to our organization, and will provide consistent messaging with Oregon state statutes as we described previously. Next slide. The fourth scenario here, youth presents to Providence Health Center reporting concerns that they may be pregnant. So one step further, where they're coming in requesting care for possible pregnancy. Again, we will offer pregnancy testing if requested by the patient. Provide a safe, comforting space. And you can see there are some themes here. we want to provide a very safe, comforting space. We want to encourage parental involvement. We will be assessing for risk and safety concerns. And we will discuss and support healthcare goals. And then again, here for additional considerations, we're not providing the perinatal or antenatal health care. Again, nice distinction though, of course, if there is someone who has pregnancy status, if they come in for something different, of course we will see them for that concern. But for this specifically coming in for pregnancy as a chief complaint, this is how we'll be managing. Pregnancy-related presentations will be referred out to healthcare providers, so within Providence or outside. Providence Health Clinic will follow all Catholic healthcare tenets, and also we will be consistent with the state statutes.
We have a list of referring agencies that you're referring to. Who are you referring to?
We will talk with the patient and see what's most appropriate for their healthcare goals. We have a lot of specialty, we have a women's clinic within Providence we could refer to. If they prefer an outside organization, that's fine too. And we can encourage family involvement and encourage them to discuss with their healthcare provider.
But you'll give them all the options as far as what is available, small abortion clinics and things like that. You'll be listing all those as well.
We refer to outside specialty clinics.
So give a list of those you refer to.
We don't refer to abortion clinics, so we will refer to OBGYN clinics. So Women's Healthcare Associates, Providence, I don't know any other in Newberg. Are there any other Newberg? Not for pregnancy.
So you'll just to those two.
Yes.
I still have a data question.
Yes.
So, yeah, what's the percentage? How many did you do last year and how many do you project in the next 5 years?
We haven't done any. So this is, we opened October 24th for physical health. So we have not done any of, any physical health thus far. We've done mental health and chemical dependency for the last 5 years. So the depression, anxiety, suicidal ideation was really our wheelhouse, expanding into physical health this year. So birth control, pregnancy would be a new sensitive scenario that we will be engaging in this year.
So what are they, like, for Forest Road, what's the percentage out there?
Oh, you mean in a school-based health center with the average percentage? I'm sorry.
5% of our kids?
Yeah, thank you.
Will they be taking away from our classes, maybe Carolina, you know, there's some statistics that we're 15, and they have smaller populations.
Certainly. So I can't speak to Forest Grove, and I don't have any specific figures around our other two school-based health centers, but one area that I will direct you to is the state has a website that has an annual report that they put out, and it has a lot of statewide data that looks at a lot of what I think you're getting at. You know, what percentage of visits are in this category? What are in this category? What are the ages? What those types of things. And so that's available on the Oregon Health Authority's website, and I would really encourage you to look at that. And then I think pulling the local data, as Elise mentioned earlier, having access to that and being able to share it back with the school board and the community is also something that is done regularly with most school-based health centers. For sure.
And I love data, so I will make sure to provide that for the school board.
I have a question.
Okay.
Previous slide said birth control is something that you guys don't distribute. What's defined as birth control? Is that include condoms?
Correct.
I just wanted to clarify, I live in Forest Grove, but I'm not connected with the student-based health center there. I'm a medical provider with Providence. I'm the clinical director for access strategies for the whole Oregon region. So just to clarify. This is my first student-based health center experience. I'm really excited.
Okay, so this is our final sensitive clinical scenario. So transgender health, so if we have a student who presents to the school-based health center and self-identifies or self-initiates a discussion around gender identity or gender dysphoria, this is going to be our clinical response pattern. So we're going to, again, as Mel said, provide a safe and comforting space. We really want to make sure that the kids that we're serving feel safe within the environment. We're going to provide support. We're going to talk about and assess and treat any mood-related concerns, so things like depression or anxiety that an adolescent may be experiencing. And then we're going to talk about risk and safety. Are there concerns around suicidal ideation? Are there concerns around abuse? Are there concerns around neglect? So those are going to be pieces that we're looking at to make sure that this youth is safe from a risk standpoint. And then we're going to talk about family engagement. So what does family support look like? Who in your family is a safe person for us to engage so that we can have a talk with your family and make sure that we get the support that you need or that your family needs, unless it's not safe to do so for abuse or neglect or those kind of really difficult, complicated family situations that we've discussed. And then we're going to talk with the youth and the family about what are your healthcare goals. The clinic itself does not provide medical treatment for gender dysphoria. So I know that that's really been a question that's come up a lot in the community. So we are not prescribing on site. Those are not prescriptions that we're maintaining on site. That's really going to be a specialty referral that we discuss with the youth and their family, and then provide that referral to an alternative location, not the school-based health center. And then Providence, I have my Catholic healthcare hat on because I've worked in Catholic healthcare for over 10 years now. Providence is a Catholic healthcare organization, and so all of the care that we provide is consistent with the ethical and religious directives as consistent with Catholic healthcare.
I would like to know what you define as not safe. Is that just where the child feels like, oh, I know mom and dad are not going to like this, so I don't feel safe? Is it that uncomfortable? Because I've known parents who were declared not safe, who were extremely very safe. So to me, it seems like a very arbitrary definition. And some of these are really hefty issues with parents who are loving and kind.
a good question.
That's a really great question. My absolute hope is that we are involving families at every scenario and every situation, especially with these more difficult topics. The times where situations have come up, and I think, I put abuse, neglect, and youth houselessness up here, because when I've gone back around times when we have not involved families, it's because I have made an active CPS report due to one of these concerns.
We had one student I would think of, religiously, student wanted to kind of back away from family's religion and said, I just don't feel like this is what I want to do anymore. I don't want to practice the way my mom and dad currently do it. The student wasn't unsafe. The student just needed to have a conversation with parents. And so that conversation happened with the school and with the parent and say, this is what we've heard from your student. We're not going to direct the parents to say, you must do this, you must do that. Sometimes we just have to be the student's voice to get that conversation going. Do we need to be a part of every student's conversation? No. I would prefer not. But sometimes students just ask, can you help me as I start that conversation with them? Like I said, this one particular student that would fall in this realm, the parent, I know the parent loves the kid deeply. And I've had conversations with mom where I can see them. And I can also see that she is trying her very best to deal with a difficult situation where student is no longer living the kind of lifestyle that the parent would ever say is okay. But mom loves the kid. And this is not one we would make a DHS referral because the kid is safe at home. This is a disagreement that there's some theology in there, and I'm not in a place to say what's true or should not happen. But kid is safe physically. He's not being abused, not being neglected. Just need to have a conversation started to share with mom this is where we're at.
I have some questions. So, has this always been policy since the wellness center was open?
Yes, this has been consistent with, I think, I can speak right, we have not had medical providers on site.
But this is the entire policy that's always been in place since.
This is, yeah.
So, as you know, I'm the animal advocate, and I published a variety of screenshots came from some threads in a group called Progressive Mental Health that several members of this panel are part of. And there was a conversation in there that was related to this. I'm looking for clarity on what was meant. So, I believe it was posted last fall. Posted by Lisa Coleman that says, want to make sure people are aware of this. Providence Behavioral Health supports students and teachers on site through the Wellness Center at Newberg High School. We are here for all your kids and teachers. Anything we can do. Coleman did a tag wellness, community wellness collective Facebook page, as well as the Facebook profiles for Kristen Stoller and Jerry Ferguson. Stoller being co-founder of Collective Ferguson, listed and shown the website as mentioned in this panel, supervising provider of mental wellness for the Newberg Public Schools, and clinical lead for Providence Medical Group Behavioral Health. Stoller replied to Coleman's post by writing, yes, we do. Ferguson replied to Coleman's post with, yes, trauma-informed, anti-racist, gender-affirming care, Providence Behavioral Health and Wellness Center are steadfast in these values. Please reach out and let us know what we can do. So my question is, gender-affirming care, how do you define that exactly? Most people define it as the treatment of gender dysphoria, but you're saying that that's something that you guys don't do at all.
That's a great question, and thank you so much for bringing it up. So I think first, I am a community member. I do live in this community, and the work that I have always done in the Wellness Center or with Providence is with my Providence hat on. Really thinking about the time around when that post was made, we had a number of students who were tagged in an app that was making, racism became a really difficult topic. And I think everyone in this room probably has a different perspective around racism and the extent of racism and whether it is present or not and the impact that it has on our kids. The frame that I have maintained is that if we have a student that comes in that reports that they are experiencing racist bullying or racist treatment, and that is something that we're going to support them in, and we're going to affirm them in that experience. We're going to help them find a safe staff member so that they can have a conversation, so that they can feel safe in their school. If a student, similarly, if they comes in with any identity marker, that's something that we're going to want to incorporate. If they come in and say, my Christian faith is really important to me, my Latin heritage is something that's really important to me. That's going to be a component of their identity that we're going to want to affirm as part of therapy. When we talk about really specifically gender affirming care, it's creating a safe, affirming space that conversion therapy is illegal. That is not something that we do. We want them to feel safe in our environment so that we can have conversations, sometimes difficult conversations. Bring families in so that they can feel supported with their family and help the family identify. And Tony brought up a really great case. Help the family identify what they need as a family unit to feel supported in dealing with some of these difficult conversations. We've never prescribed on site. We haven't had a medical team, so this has been the approach that we've had for the past 5 years.
I didn't mention gender emerging treatment like that. It was gender affirming treatment. What the definition is, it's not treating for gender dysphoria, and you don't do complex psychiatric.
Our goal is to be an affirming environment. We're not doing gender affirming medical treatment.
The way you said it.
I didn't say that we're doing gender affirming medical care. We're providing an affirming space. We're providing an affirming space.
You mean in the on the
I think it's important, Carrie, to remember too, though, that where we are today, and you very well know, versus where we were then, gender affirming care was not a hot button word. Gender affirming care is widely used in medical practice across the country. There's a difference between the environment of affirming a child, or like she said, any identity, and prescribing gender affirming hormone therapy.
I understand that you can include hormone therapy doesn't necessarily need to include that, but it's just the treatment of gender dysphoria, which is a normal psychiatric condition, which most people consider to be a complex psychiatric condition, which you say you don't treat for. You say it's fine.
When we say treatment, we're meaning medication. So that is that from, and it's a good reminder to people in healthcare that not what we know as what a definition of the word is not always what the community knows as a definition of the word. So I will take that to heart, and treatment to us means prescribing a medication or a procedure.
On that note, since it was also mentioned in the comment, what was meant by anti-rhesus?
I just spoke to that as far as like a child coming in who has concerns.
I'm sorry.
The piece that I just spoke about around a child coming in saying that they have experienced like racist bullying or reporting that they've experienced racism, that's something that I'm going to hear them and affirm that experience and help connect them with a safe adult so that they feel safe in their school to have a conversation about that. We really want to look at meaningful identity markers. I talk Christian faith, Latin heritage, and who are you as an individual so that we can support you as a whole human with those identity markers that are really important.
Okay. What was the definition of trauma?
Oh, that's a really great question. Trauma-informed considerations for healthcare, I think really looking at the impact of adverse childhood experiences in an individual's life. So there's some really great research around adverse childhood experiences that start early in life. Many of us, they're more common than not, have had these. So looking at things like family separation, abuse or neglect in the home, parental divorce, having a parent that has an emotional health condition, having a parent who maybe has a substance use condition. We know that these are significant concerns that impact a family, and there's really amazing literature around how having those adverse childhood experiences can go on to impact an individual's physical health and an emotional health later on in life. And so really what the goal of trauma-informed care is how do I look at you as a whole human and the context and the lived experiences that you have had and take those into consideration so I'm putting together a treatment plan that supports all of those components and then also approaching that individual in a way that is responsive to prior adverse experiences that they've had.
How is that different than other types of anxiety? I'm confused.
I just want to let everybody know, we do have other slides besides this one, so as we go, we start wrapping up some of these questions or some of the scenarios.
But I do think it's actually fair to answer some of these questions because I think some of the posts that you've made have led to some feelings in the room that I think we should air out as a especially me as a leader, you know, I've said to you twice, and to anyone in the room, that I welcome anyone to give me a phone call, an email. I have not had that from you. There's been lots shared, and I would be happy to have that conversation. I feel this way about both sides of the aisle, to be clear. Both sides of the aisle have created harm and hurt, and I'm trying to do my very best to come to the middle and have a true dialogue of how can I help bridge the pain that we're in. I don't believe healing can happen until reconciliation happens. Part of reconciliation is admitting that you have a piece in the fault. I am happy to do that right now.
I'm not really looking to have a debate. I'm just looking for clarity on what the term is meant by trauma informed, how it's different from normal types of anxiety treatment.
Well, okay, but I also think that it's important that all of us have a lot. All of us are trying to come to the table, and I want, when you're pulling up tweets or, you know, Facebook comments that were made a year ago, that's pretty difficult, and we're willing to entertain that because we really do care, and I actually want you to hear from me the truth behind those comments. But I don't feel like we can move forward as a community until we move forward, and I feel like as a panel we're making that statement.
Mr. Martell, could you speak up?
What? Sorry.
Mr. Martell, Facebook is asking for you to speak a little louder, please.
I'm just here, trying to understand what you're saying. Are you saying that you want to debate the content of my newspaper?
No.
Instead of just answering the simple question of what trauma-informed care means and how it's different than standard types of anxiety, you know, treatment to warrant a special category?
No, we're happy to answer the questions. I was just responding to you printing on the comments from Beth.
Printing out to one to make sure I got it right.
Okay. Go for it.
Did we answer the trauma-informed care or something?
Yeah, so trauma-informed care is not in and of itself a theory, and it's not singling out a specific group or providing like a specific accommodation, I think, or a diagnosis. Adverse childhood experiences are very common. They are more normal than not. And so it's really approaching healthcare, all of healthcare, from a frame that takes into consideration an individual's context and their lived experience so that we can provide them the best care possible, given the pieces that make them who they are.
We had a question over here.
Yeah.
I'll leave it.
Thank you.
Behind Sylvia, I'm sorry.
Yeah, just a member, John Ryan, question statement. Since the John Ryan that was accepted. Continue, please.
Okay, before we move on to billing, is there any, I really do want to make sure that we address any questions that people have. And I also thank you for bearing with me as these are really difficult conversations. And I also want to say Chair Brown has been willing to entertain these difficult conversations too. And so thank you for that. I really appreciate that. But any further questions before we move on to something a lot more boring, billing?
We might have a question/suggestion from Facebook. Community member Kristen Stoller. Thank you, Dr. Jerry. Sounds like a community gathering with more information and training could be helpful, ? Maybe wanting to plan something in the near future to continue these deeper questions, perhaps?
We would be happy to have any future conversations with any community member that would like to have that.
Please.
Yes.
I think just to pivot on that question, I spent 20 years here working, 56 years coaching in the district as a paid coach. Probably my biggest reward in this district was standing at the south doors with about 300 kids walking through the door every morning saying hi to them and just figuring them out. Some of your kids, I see your faces, your parents of those kids. And then when you build that relationship up a little bit, you get the opportunity to turn them over to a principal like Mr. Buckner, who used to be principal, or Officer Moreland and I would talk, we'd get them to a counselor. You just get that initial treatment, you know, just get those kids comfortable. That was my favorite thing to do here. And most of the time I never got to coach them. They just needed somebody to pointing in the right direction. High school kids and middle school kids are tremendously under a lot of pressure, and never more than they are now. And this school board's committed to trying to help those kids no matter what, even in this political climate. This entire school board does care. And I know the teachers care and the staff cares. If we can put all of our differences aside, it's all about the kids. And that's why with this whole thing with Nels and Elise, we've had to sit down and have disagreements and go back and forth on this for sure. But my excitement is that a child will have an opportunity to get help sooner. Our counselors spend most of their time scheduling. And that's something as a school board we'll be talking about very soon. I'd like to see them spend more time counseling, and then they can get stuff done before they even get to the clinic. So there's lots of room for improvement. Looking around this room, I know there's people that agree and disagree on a lot of things, but we do agree that kids are going through the most difficult time ever. And we can't blame it all on COVID. And so if we can, 8 to 4, we can help these kids, 8 to 5, as much as possible, you know, that's the goal. It's not politics. It's not Republicans or Democrats. It's none of that. In my 20 years, I had 6 kids pass away. Cancer, car wreck, drugs, car wreck, suicide. Spoke at 4 of the funerals. So what was said earlier, it's something we never want to go through again. And so are there questions about the health center? Yes, from the school board for sure. But at least Nels has been very upfront, and Dr. Phillips. I just want to say that my biggest goal is to help every single kid that walks through that door. And when you talk to them, they'll start to talk. And when they talk, it's not always good stuff. They're putting up with all kinds of crap out there in the world, and they need us to put our heads together or something like this and help. And the biggest thing I've challenged Nels and Elise is transparency. And so hopefully moving forward tomorrow, the next day, the transparency. My last thing would be, you know, screenology. We've known for 10 years screenology is rough. Have we done anything about it? No. This administration, the previous one before that, no. And there's big questions out there to tackle. And we've got to get these kids in front of people that, and high school kids think today, they think 1 hour, they think 30 minutes, they think 10 minutes. So stay involved and help. Come to more of these. There'll be more of these meetings.
Thank you so much. Okay, so this is a good slide, as is the next one, the screenshot or take a picture of. I think
Just wait till it goes on the website.
Or wait till it goes on the website, that's fine. So just high-level billing information, something really cool about this site that is different than if you're walking to a Providence clinic is that if you're a Kaiser patient, we have a way with Oregon Health Authority to drop a modifier so that you are in network, which is we can't do that at the Providence clinic. So that's, I think, a really exciting thing for Kaiser insurance numbers out here, is there's not a local Kaiser clinic, and your kid could be seen within the school-based health center and be treated as an in-network charge for Kaiser plans, which is really exciting. Same for other plans as well that are not accepted at Providence. Pacific Source would be one of those, United Healthcare another. So those will all be in-network charges at the school-based health center through a modifier dropped on the chart, which is really exciting. What that doesn't mean is that it's a free service. So the next slide here, actually go back one more time, I missed on medical records. So again, about transparency. So if you are a parent that wants to request medical records, that is the number for Providence Medical Records that you could do so. And so full, you have full access to be able to do that through that phone number. The scheduling number.
Is it where it says hard copies, or is it Providence School Plan?
Yeah, so hard copies, thank you. So My Chart, you can also, we will be signing up every child on My Chart. So My Chart is another way that the student can access their records. There is some difficult things with certain age groups with My Chart, but for the most part, you should be able to access a lot of your records online. And then the scheduling phone number is listed there, and so that is our phone number for the school-based health center. It is actually a Providence number. that is on 24 hours. So if it's 11 o'clock at night, this is also a cool service we'll be able to provide the district. You could speak with a nurse who could give you triage support at any time, 365 days a year. So yeah, and then this is, so back to that not free thing. So mental health that we've been providing for the last 5 years in coordination with Yamhill County. Our PsyD students that are through George Fox University, supervised by Jerry, that will continue to be a free service. So meaning that we don't bill your insurance. And then Yamhill County does bill insurance for their mental health work. The last I've heard, we've had no complaints in really 5 years around billing with Yamhill County. And then for physical health, I've taken the most common charges for this type of scope of services and listed out pre-insurance what those charges would be. So the deductible question that Chair Brown brought up in our last conversation was, what would the charge be if it's January and you haven't met your deductible yet? So just very, very similar to if you were to go see a Providence provider or your Kaiser provider, it's going to be a similar charge. But I've listed all of those out for in-person visits, virtual visits, a nurse visit, which would oftentimes be education or wound care. Testing meaning a COVID test, a pregnancy test, that would be a sliding scale between $15 and $47. And then ear lavage, and then vaccines being free. For labs, that is a really difficult determination to put on a slide. I'm going to create, we have a page that we'll put on the website of lab fee costs, because that's an outside entity that I don't have a lot of control over. So I'm going to just, I'll give you the one pager to put up there. Okay, next slide. Okay, so this is a really neat slide that just shows other communities around the state that have a school-based health center. 81 communities within Oregon have a school-based health center, which was crazy when I found that out. I had no idea. So some like-minded probably communities on there. McMinnville, Yamhill Carlton, I found out doesn't have theirs anymore. Willamina, Roseburg, Grants Pass, Vernonia, Sisters. So there's quite a few on here that are a similar makeup from Newberg that have current active school-based health centers. Next slide.
So one question that I have that
That's it.
How can I see what this place looks like? Like you mentioned the school-based health
Yes.
center. How can I see?
Okay, so this is the open invitation. So tomorrow's teacher conferences. And so we would love to invite anyone, Facebook, the whole community, anyone to Wednesday. You can come tomorrow too if you want. The rest of this week we'll be in the school-based health center unpacking boxes. So if you give us a little grace that it's not perfect, we would love to invite you out anytime to do a tour through. You can ask any additional questions you might have. Alexa will be there. Myself will be there. Jerry will be there. Mel. We'll all kind of do rotations. Jan, who's down there? Jan, our resource room lead, will be there. So you can come and take a tour and see the whole space.
And if we can't come tomorrow or Wednesday, then how else can I see?
You can email me.
The virtual.
Oh, just what are you trying to get me to say? We're going to be doing a virtual tour. Our friend Rose will help us make a video and post it on the Newberg Public Schools website, Facebook, and take you through with a virtual tour so you can see the whole thing and meet all of our team.
And it'll be on our website.
On the website too. Okay. Any more Facebook questions?
Yeah, there is a Facebook question, and it may have been mentioned briefly earlier in the beginning, but our Mrs. Stoller is very curious about hearing maybe in detail about the privacy policies around students receiving services.
So we do have a confidentiality, privacy, we'll see if I get it right because Melissa is the one that wrote the policy, but we do have a privacy confidentiality policy, and so we will post all 10 policies on the school district website, so any parent can take a look at that. But in terms of who's accessing the site, it is just like a regular medical clinic. That is the benefit of having Providence, is that it's a professional medical clinic that is billed as such. It's not billed as a school location, it's billed as a medical clinic. So all HIPAA rules would apply in terms of this being a medical site.
I would say the rooms themselves have been purposely built and constructed in a way that even highlights our commitment to privacy. The rooms of the mental health, the behavioral health, or the physical health rooms have been double insulated. They have white noise speakers in there, so even a student or a staff member or anyone that visits the school-based health center, you're not going to be able to hear the comments made in even the next room. That was something very important, which Sylvia did a fantastic job in our last situation where we needed to create some white noise just so students felt safe talking with Sylvia and other folks from Yamhill County and Providence. Great suggestion that went into our planning with the school-based health center, and now we have rooms that are, I think they even surprised the medical community when we said what we were doing to make sure our students felt safe and protected in what they say in these rooms.
I also wanted to just say, Jan at the end, she's like hiding from me so we don't call on her, but she is the lead of our resource room for Newberg High School that's within the health center, and we are so excited that we get to be together in one space because we do a lot of back and forth between a kid that's presenting in the resource room, maybe wanting some food or some clothing, to then connect with us for any additional type services. So Jan, would you like to say anything? You're the fun one. What?
I didn't prepare anything.
Okay. Well, you should definitely walk through the resource room as well when you come to the health center. It's in the same space, separate but under the same roof. So, any other questions on Facebook? Oh.
How is this funded? Is there information about all the different funding factors and then how it's going to be continually funded throughout the years? This is a very large project.
Yeah.
And so I would think, is Big Pharma putting in money? Like, where is all the money coming from? And how much of our budget, school budget, will be used in this project?
Yes. So the capital cost to renovate the building was a part of the bond. So that's the first piece of it. The second piece of it is we get, through being credentialed with Oregon Health Authority, we get $60,000 a year for operational costs as the medical sponsor. So that comes to Providence. To put it in perspective, that covers a 0.6 nurse. The rest of the salaries and supplies, medical equipment, all of that is being covered by Providence. In terms of operational costs for the school district, what the school district is responsible for year over year would be the maintenance of the building, janitorial services, security.
And Miss Katie.
Officer Moreland does security. What?
And Miss Katie.
Katie, yes.
Our one school district employee that helps serve the school-based health.
And we haven't talked much about Katie, but Katie is amazing, and she is really a great liaison between the school counseling department and the clinic. So if getting kids to and from, she will do a lot of supporting of getting the kids to the center, and she also just has such great relationships within our high school kids and staff to really be able to support the kids. So we love Katie.
So Providence is footing a lot of the bill.
Yes.
So what does Providence get out of this? Other than just helping the community, there's got to be something there.
Could you repeat the question just so they hear it a little better online?
What does Providence get out of this? So this is a question that's been asked a couple different times, and I will say Providence's future in the next 10 years is very centered around population health and ambulatory care and trying to get people out of a focused hospital. This is one of those ways, especially in a rural community, that we can provide a low-cost access point for a population that we don't do a great job of engaging. So adolescents, we have lots of metrics that we have with different insurers, Yamhill County Care Organization being one of them. The metric we never meet is adolescent well child checks, because It's really difficult to engage with adolescents unless they need something right then, right? I'm guilty of that with mine. So that's really the driving factor, is how do we do a lot of our preventative care work on kids when they're in that stage, so that when they get to us, because they will, and we're paid differently now. We now have risk-shared agreements with insurers, capitation agreements. We are not paid anymore based on acuity of the person coming in the door. Where we used to get paid, Lonnie comes in, she's really sick, we get paid for really how sick she is. Now we're shifting into, we get paid for how well Lonnie stays. So that's really where that incentive from a strategical standpoint comes in. Of course, then we're all embedded in the community and we just want to be involved on this level. But from a Providence perspective, I think that would be pretty accurate.
So as you are seeing kids and prescribing things, that seems to be the getting them onto big pharma. How are you going to regulate, encouraging them to be healthy, exercise, and to be healthy naturally, and to do things that are from the mental health in a natural way, and saying, hey, supporting them. We're a big community of you matter and we love you just the way that you are, right? Versus giving them a prescription and putting them on medication that they'll be on for the rest of their life. And to me, it seems a little bit of a conflict of, you know what I'm saying? Like, this is kind
I
of
do.
over here, and it seems like a conflict of interest.
I hope that that I didn't give the impression that we're trying to get people on medications. If anything,
What's been happening in that office? I mean, are you going to be quick to give a drug, or where is the self-regulation there on how we care for these students?
Could you just repeat that basically?
where's the self-regulation?
Well, how are we going to regulate how quickly we give a student a prescription versus all of the preventative care in advance? Right? Does that make sense?
Absolutely, and I can speak for our team up here, I think, to say that prevention would really mean education as a part of the conversation. I know the prescribing providers sitting in the room are not heavy-handed when it comes to prescriptions. So I feel like we've matched the providers with this clinic very well in terms of education, prevention, which includes healthy behaviors, inclusion of safe family and friends, exercise, all of those things before going straight to medication. But absolutely, medication will be prescribed if they are already diagnosed with asthma, right? Or diagnosed with diabetes. We absolutely will provide interventional therapy of a prescription in those circumstances. But this really does bring up, and I think this is a great conversation, these are the type of things we can provide data, right? And I think that I'm hearing from the room, it's going to be really important to provide on a quarterly basis data for the school board, data for the community that we can publish on the website so any parent can take a look. Medication prescribing is one of them. Like how many prescriptions did we do for depression, for anxiety, for hypertension? I think that would be really interesting information, and then also do some of that trust building. I hope that we really are true to our word.
Early on, when Dr. Ferguson was speaking about some of the scenarios related to behavioral health, the things she addressed, and you'll probably find it in your packet, but the things she addressed first were healthy lifestyle, eating better, exercise, and all the things that Elise just listed. The medication's down at the bottom of that. That's not anyone's goal here to bring something to the door and write them a prescription. Their care will be first the things that Dave Brown talked about, the things that Jerry talked about, all the things we can do first that will help benefit them to handle their anxiety, their depression, whatever. Those are going to, hopefully that's in your packet. That's what I heard Jerry saying, but that's confidence.
Absolutely, and we will be following general medical guidelines. We have licensed providers in this clinic, and this will be, we've handpicked our providers who are most excited and passionate about our youth and preventative care, and we are not going to be handing out, that's not our goal. So we will be practicing medicine appropriately as we would in any family medicine clinic within Providence.
I would add to it, Speaking for Nelson and Elise, Dr. Phillips and I, we've had tough talks, and we don't always agree. So I challenge you, if you're in this room or if you're on Facebook, I know Elise is tough enough to handle your questions, and because she's had to handle ours. And there's people in this room that don't want to communicate because they're mad. So quit being mad and just come talk. You know, if you got something to say, quit doing it on Facebook. You know, get off Facebook, quit fussing and whining, and come talk to people. Elise is tough enough to handle it. Nels, I think you're tough enough to handle it. And then there's a lot of questions about all this stuff. So come up and ask the questions, email, call. I would welcome it instead of seeing it on Facebook and making stuff up that's not true. That'd be awesome, you know, that we can just get the truth out there. Elise can handle your questions. Ask her the tough questions about this health center. And I think the more we work together, we talked about this is a day-by-day, week-by-week type of thing to be transparent about everything. And some of these questions are tough. Keep asking them. And at least I'm speaking for you, but I know you're tough enough because I've asked you those questions. So please put the social media aside and just talk to people.
So we have one last final minute. Again, I just wanted to quickly share Newberg School District website. If you go down to School-Based Health Center, HBHC, you will see a page with all sorts of different hyperlinks. Today's slideshow will be on there soon. You gotta give me maybe a couple hours to put it up there. As well as any policies that we've got, probably the 10 tenants and other policies that we're gonna run through OHA. Contact information on there as well, and we'll even say contact and partners. This will tell you exactly how to reach the people so we can do exactly as President Chair Brown says. Let's talk to people. Here's our phone number, here's our email. Let's set up a date. Thank you. I did that on purpose. Can we give our panelists,
Thank you guys.
So again, please come to our open house on Wednesday. You'll see our virtual presentation going on. I think we're going to post
Monday.
it on Monday?
Well, because we're going to be doing, you're going to be coming doing your video, right? On Thursday. So
Yes.
it'll be posted on Monday.
Posted on Monday. So, thank you all for coming to the audience. We appreciate your time and your support.